Are you considering doing a dental residency after dental school, but need some more information? Stay tuned as we talk to a residency program director about a program in New York that you should consider. Stay tuned. This is Dr. Darwin, the new dentist coach, with another episode of Ask Dr. Darwin on the New Dentist Podcast Show, where we talk about getting into dental school, surviving dental school, getting into residency, and then surviving residency, and then life as a new dentist. Be sure you guys are checking out my YouTube page. Subscribe, hit those notifications so that you are aware every week when new videos are released. So today we're going to be talking about dental residency, the importance of dental residency, what things candidates should consider as part of their process, what a typical day looks like, some strengths and weaknesses or areas of improvement, and why you should consider doing a residency. Today we're joined with Program Director Dr. Ricardo Boyce. Hey Doc, how you doing?
Hi, how you doing?
Good, man. So glad we're able to connect and get this important information out to those that are considering residency.
This is true.
So please, if you would, just share some information about yourself and your background too.
Yeah, so I was born in Panama City, Panama. My parents moved here when I was like 1 year old. I grew up in Chicago, Illinois. After high school, Hyde Park Career Academy High School, I went to Tennessee State University. While at Tennessee State University, I personally majored in dental hygiene just to see if I was interested in dentistry. And it turns out I was. I had wanted to be and had the desire of being a dentist since the age of 7, somewhere around that time. I really never shared it with anyone, but deep down it was there. I think I posted it or mentioned about it in my high school yearbook that I wanted to be a dentist. Had no clue, no idea. But when I went to Tennessee State, I noticed that they had a dental hygiene school, and I said, well, let me try it out. Turns out I did really enjoy it. I took my prerequisites that were needed for dental school, and I got accepted at Meharry Medical College in Nashville, Tennessee. And after receiving my doctorate of dental surgery degree, I went to St. Joseph's Medical Center to do a 1-year GPR in Reading, Pennsylvania. Far place from Chicago and yet even Nashville, but St. Joseph's was the place for me. After St. Joe's, I decided to do oral medicine residency at the University of Pennsylvania, and really the foundation of that is hospital dentistry. I never thought about going into hospital dentistry. Let me just be clear about that. I always envisioned and saw myself going into private practice. I thought I would be in private practice. But I was prepared and trained with my 3 years of residency to work in any hospital in the United States. So that's just what I did. I applied to work in hospital settings. And it turns out that was a bit of my calling. I didn't go in to look to be a program director, yet alone interact or teach residents. It just kind of came to, it just unfolded that way. I've been at Brooklyn Hospital for 15 years, and I've been program director for 13 years at Brooklyn Hospital. And, I've learned a lot, and actually have done my share of helping out the underserved, and which is part of my mission and a part of what I do. I think it's part of my purpose here, while at the same time, teaching young dentists how to prepare themselves for the future, for those who want to go into general dentistry and choose to do so in private practice, but also for those who want to go into public health, if they want to work in a hospital setting, or if they want to go into specialty training. So I pretty much do the same thing that you do there, Dr. Darwin, in regards to guiding these young people along the way. Not as popular as you, but we do the same thing. I'm on a much smaller level.
That's all right. As long as you're on the level, that's all that matters at
Amen.
the end of the day.
Amen.
So great. So let's dive into the meat and bolts, because this is what people really want to know as far as considering residency, what to expect. So if you could give us just a brief description about the uniqueness of your program at Brooklyn Hospital.
Well, what I try and tell young people when they come and interview, that they're going to find that all residency programs are set up a little different. There's no one residency program, or GPR for that matter, that's the same. Let me just go back. When I completed my GPR, we did not have an oral surgery residency program. So we, as in fact, we didn't have any specialty programs. So we did everything. Anytime you tack on a specialty program with that GPR, the GPs are going to see less of whatever might be geared towards the specialty, if you will. And because we do have an oral surgery residency program at Brooklyn Hospital, our GPs are seeing less, if you will, oral surgery, but they do sit in on the conferences with the oral surgery residents and the oral surgeons. So they are learning didactically. The clinical training might be a little, on the low side, but we actually have implemented an oral surgery rotation. Since I've been director, we try to implement that oral surgery rotation for the residents throughout the program. They've always had it there, but I actually, sorry, I think I hit a button, but I actually try to make sure that oral surgery rotation continues over the course of the year for our docs. What makes our program unique? Our residents do get exposed to oral medicine and oral lesions, and being able to diagnose them and knowing how to treat them, and manage those type of, and then also being exposed to the operating room and operating room dentistry, which we call oral rehabilitation. And, so we have certain cases and patients that we may take to the operating room, and we give them that exposure and that experience. We are more of our strengths are restorative. So we are strong in that area, if you will. Our weak area would be surgery or oral surgery, and that's mainly because the oral surgeons are getting more of the surgery cases. But it's not to say that the GPs don't do extractions. They do their extractions when they go on their rotation.
So if I'm a candidate and I'm looking at your program, what are some of the things that you as program director are looking for those recent grads that are looking to matriculate into a residency program?
Yeah, so you know, it's tough for us, and I say us because you were program director as well, to gain much about a potential candidate in one particular interview that may last anywhere from 15 minutes to 45 minutes. So I do look at what their professors have to say about them and their conduct and their character. You know, I want to know about integrity. I want to know about work ethic, you know. And I definitely want to know about their knowledge and how they do in their courses. But it's also about their interaction with the professionals that that they work with, meaning their professors. You know, we want someone who is going to, you know, going to respect the other attendings. You know, because I have to think about this when I'm interviewing. It's not just about me. I know they'll have to interact with me, and I'm perfectly okay, and I'm fine. You know, I think I've probably been able to teach young doctors from almost all of the dental schools throughout the United States within the 15 years. Not all of them, but majority of them. And therefore, I've seen and treated, not treated, but actually seen and taught people from different backgrounds, cultures, races, you know, and ethnicities, so forth. And, you know, but dentistry is our common goal. I mean, that's where we, you know, link up eye to eye. And, you know, the young dentists, they are looking for a mentor. They are looking for someone who can help them to understand, you know, this complex discipline that we are involved in. I mean, they've learned a lot in the 4 years of dental school. And how do they bring all of this together? You know, how do they take all of this knowledge and bring it together? And being a program director, you know, we have that capacity. We have the ability to at least, you know, show them how to carry themselves and in the direction in which to go. I'm not sure if I answered your question.
Yeah, no, that sounds good. That sounds good. I'm sure a lot of people want to know more about what a typical day looks like for a GPR resident or a person. So can you share a little bit more about what a typical day looks like from maybe 8 to 5 and then from 5 to the evening?
Right. So some GPRs have didactic programs and some don't. You know, when I was a resident, we started at 8. We started seeing emergency patients at 8, from 8 to 9, and then clinics started. You know, meaning your patients, you started seeing them 9 to 5. But you know, at Brooklyn Hospital, we do have a didactic program, and so the residents do meet in the 8 o'clock hour at least 3 to 4 times out of the week. And then clinic starts at 9 and goes from 9 to 5. They do have call that they take call with the oral surgery residents. But they also have these rotations. So the residents, they rotate in emergency medicine for 2 weeks. They rotate in anesthesia for a month. They rotate, let's see, there's the oral surgery rotation, which is a month and a half. We have an orthodontic rotation where they rotate with our orthodontist.
And how long is that rotation?
So that rotation is a month, and it may extend like a month and 2 weeks. You know, we try to get everyone to rotate through it. So it may actually be more like 2 months, because we give them a month of rotation initially, and then it, after everyone gets their rotation, then we create another method for them to rotate. But they do it throughout the year, Let me see. I think I covered all the rotations. We did once upon a time have a pediatrics rotation where they rotated in the Department of Pediatrics, and they screen children, and if the parents did not have a dentist, then they directed them to our clinic for dental services. But working at Brooklyn Hospital, since I've been director, has been pretty much like a box of assorted chocolates. I mean, they have no clue as to what they're going to do the day that they, unless they're on rotation. But if they're in the clinic, they have no clue. There are some programs that actually have block sessions. So, in the morning, maybe you'll get operative. In the afternoon, maybe you'll have perio. The next morning, you'll have removable. We don't operate that way. They could go from, a treatment plan with one patient to, say, for instance, a root canal with the next patient, and the following patient could be a complete denture or partial denture or whatever the case may be. So, that, in my opinion, actually prepares the resident for a private practice type of situation,
Yeah, I was going to say, it
kind of keeps them on their toes.
Yeah, it sounds very similar to, what you would experience in private practice as far as,
exactly.
Having those types of procedures throughout the day. Although there are some practices that like to have some kind of block scheduling with maybe more major procedures during the day, emergencies in that first half of the day, and then the afternoon could be some basic restorative. It could be some deliveries and things. But that sounds like you still get a mix of the comprehensive care throughout the day, throughout the clinic day.
Yes.
Next is strengths. Strengths. What would you say are the strengths of the program? And then we'll talk a little bit about where you think where you guys are, doing assessments to improve and enhance the program as well. So, what are some of the strengths of the program?
Well, so one of our strengths is we do give the residents a platform. We give them a platform to present. So we do have a journal club. And with that journal club, we have it throughout the year. We meet once a week, and everyone gets, a full hour, if you will, to present an article, that particular session is actually journal club / case presentation. So, if they don't have a case to present, I give them an article to read, and they present it via PowerPoint. It gives them a platform. This platform will be actually helpful if they choose later on to go into residency, to a specialty, because in specialty training, you will have journal clubs and you will have sessions where you present cases. At least we did in oral medicine. So, I give them that platform, and it gives them a voice. It gives them the ability to interact with their colleagues, and it gives them a little confidence as well. Now, the other strength, it's tough post-COVID, if you will, because in pre-COVID, in dental school setting, residents basically saw 2 patients a day. They saw a patient in the morning, they saw a patient in the afternoon. And maybe if they were lucky, they were able to get 3 patients in. That's the dental school setting. But in our setting, we try to get the residents to see it, somewhere around 4 patients in the morning, at least 4 or 5 patients in the afternoon. Now, because of the fact that residents are rotating, sometimes they may have situations where they would see more patients than that. And the whole idea is about building up their patient load, which builds their confidence, builds up their speed, and again, prepares them for private practice. Now, post-COVID, it's tough because we actually have to, you know, the hospital is monitoring how many patients we actually bring in, and they want us to keep, you know, certain space in between each patient. And that's understandable. It's for, you know, and you know, that's what we have to do now. So, but we still expose the residents to many different aspects of dentistry. Another strength, we do have an implant day, and it's, you know, some GPRs offer the residents to be able to place implants. Because we have an oral surgery residency program, the oral surgeons are placing the implants. We have that understanding. After they place the implants and it undergoes osseointegration, then the patients come to us and we restore them. You know, single units, multiple units, overdenture, roundhouse, whatever it is that comes in, we restore. We have implant day twice a month, and you know, we expose the residents to this aspect, and we do that throughout the year. As I mentioned to you before, I bring in the oral medicine and the and operating room dentistry, and we do have a pediatric dentist who works with us, and he's one of my former residents as well. And you know, we have a pedo day, so we have 2 days out of the month where they see children all day, the residents, you know, and that's another way of keeping them on their toes, if you will. In dental school setting, you know, you get exposed to pedo, but you may have very minimal interaction with children, unless you do some form of an outreach. And but definitely coming through, you know, GPR residency, and especially if the residency has a pediatric dentist, you're going to get exposed to some pedo. So we have pedo day, and then the other 2 days that they're not in the other 2 days for pedo that they're not in the clinic, they rotate in the operating room with our pediatric dentist, so they see children in the OR setting as well.
That's good. Yeah, that OR setting experience is great. It's a great exposure for those with those cases that need to go to the OR that you just can't do
Exactly.
in the operatory. So you mentioned some strengths. Where are some areas that you guys have over the years begun to do some assessments, or through assessments have noticed where there's some areas that are improving, or areas that you want to improve or add on to the residency experience? What are those areas?
Well, I mean, we would love to, you know, have an endodontist, you know, because it would minimize. We do root canals, you know, and but sometimes there are some cases that, you know, based off the curvature of the root, and or dilacerated root, if I, you know, want to put that in. But you know, there are some tough endo cases that, you know, that we may have to refer out. Second molar endo is another one. I mean, you know, I have done second molar endo, but it is tough, you know, and so I don't force second molar endo on my residents. If they want to try it, I'm okay with it. If they run into problems, you know, I'll come in to help. But if I am having problem, we're referring the patient out, basically. But so we basically do first molar endo on anterior, and but, you know, having an endodontist would be helpful to our practice. You know, if I could implement a way for the residents to be able to have more surgery, meaning do extractions every day, I think that would be, you know, that is an area of our weakness, but, you know, but we understand and know why it's there because of the oral surgery residency program. I mean, you know, if there's a way for me to be able to do that where they can get more extractions, you know, I would do that. I mean, that's how it was in my program. I mean, when I did my GPR, we extracted teeth every day. So that's the only thing that I really think that I wish that my resident, and then outside of that, would be to implement the placement of implants, not just simply restoring them, but actually, doing bone grafts and sinus lifts and placement of implants. I mean, so that's the direction that dentistry is moving in. And yes, it would be nice to implement those things in our program.
Gotcha. That's a fair assessment of the strengths and the areas where you're looking to make some improvements. I think that's helpful as well. So now the residents have completed all the rotations. They've got some experiences, probably want to have some more experiences in some areas. That's common across, all residency programs. 365 days is still not enough time, even though residency is not mandatory, but it's strongly, should be something that people strongly consider. So completers, residents are completing the program now.
Right.
So share a little bit with us about, what from your program, what do completers normally do? Do they go directly into private practice? Do some of them like that underserved population and being kind of like in public health? Do they go that route? What percentage of them seek specialty training as well?
Okay. I mean, I would say probably about 20-25% of them go into specialty training. The majority of them go into private practice, and that's well and understood. For myself, when I completed my GPR, I wanted to go into private practice. And if you asked me in dental school what I was going to do, I was going to do that as well. The residents that I've trained that went into specialty training, I've had one that went to Harvard to get his master's in public health. I've had at least 3 go into pediatric dentistry, 2 that went into endo, 1 who just graduated from oral surgery residency, and and 1 just graduated from ortho residency as well. So, we do have some that, and there may be some others that I can't think of right now, but we do have more that are applying. And, right now I just graduated about, I think 7 residents, and the majority of them are actually applying to specialty programs. I see this trend increasing over the past few years. When I initially started out, the majority of the residents, they went into private practice. We do have some that went into public health, and that's appreciated. I try to encourage them to consider going into hospital dentistry, if you will. Mm-hmm. And at least they've been exposed to it, so they already know about it. Yeah. But, it's really about the person's passion and, what they feel passionate about. I don't force anyone to do anything that, that they don't, they're not interested.
Right.
You got to do what you love, and what motivates you at the beginning of the day and the end of the day.
Yeah. Well, I think that's key. And we talk about motivation into, getting out of dental school and going into whatever's next for people. One of my philosophies and my thoughts is that, everyone should do a residency, and you'll find a lot more specialties depending on the specialty. We are strongly encouraging applicants to have at least 1 year of residency, whether it be GPR or AGD. I wanted to, from a program director's perspective, I wanted to get your input on why you think doing a residency is important and how that impacts new dentists as they continue to progress through their careers.
Yeah. I mean, in medicine, fulfilling a residency is mandatory and dentistry is optional, you know. So, but what it does is that it gives you, you know, a certain level of discipline as it pertains to the profession, and structure and order. You know, there are a lot. There's a lot of information that is shared in dental school. But you know, one thing about a GPR is that it will be able to expose you to the other fields, but it also allows you to take in all this information and know how to move forward or in a direction that you feel comfortable with, because it's an immense amount of information. And sometimes people just are not sure as to what they want to do. You know, in New York, there are a group of us. There's upstate dental directors, downstate dental directors, and we know that the dental schools are not, or really are unable to teach the students everything there is that they need to know. Okay. So this is well and understood. This is the reason why, and the number one reason why in New York State, you must do a GPR in order to achieve and obtain your dental license.
That's right. That's right.
Just passing a board, just passing a regional exam is not going to cut it. You have to prove, you know, to your colleagues and your superiors that you are fully capable of being able to either go into private practice or go into a specialty. But, you know, it gives you a certain platform, and you're able to show what you can do. You know, and I respect that. In medicine, this is, you know, usually they do what, 3-4 years of residency, maybe longer. And, you know, the same should be applied in dentistry. There are some other states that have followed New York in regards to, you know, making sure that it's mandated that they fulfill a residency prior to. California is one state, Delaware is another. And, you know, I just think it just makes a person better. The other thing is that, you know, in graduating, I mean, I had classmates, you probably had classmates as well. They had family members who were dentists, you know, it could have been a mother, father, auntie, uncle, whomever. And they were able to take them, you know, under their wing and kind of teach them whatever it is. So then maybe in that situation, you don't need a residency, right? You have somebody who can teach you X, Y, and Z, you know. But for people like myself who didn't have, you know, a family member who was a dentist, I needed something along the lines of the training of a residency. And, you know, and I knew this from, you know, very young. I just really wanted to do 1 year of residency. And it led me to what? Becoming program director. So, you know, I think it's, excuse me, I think it's you know, it's definitely important. It's needed. I don't know how to get this message across nationwide. Maybe you and your platform, you'll be able to do that. But from what I have seen, and have been able to see how residents come in, meaning as they come in, former students, and then I see them at the end. So I see the finished outlook.
Right. And lots of times
the finish
is different.
Oh my gosh.
It's like night and day.
Absolutely.
And I think to add to that, to add to your point, it's like night and day, and even the residents will notice the change, because I think going into it, a lot of them don't even know what they don't know.
Exactly.
And I say that over again. You don't know what you don't even know.
That's true.
And until you get into a situation that's not 1 patient a day or not 2 patients a day, but it could be one of the 10 patients that you're seeing that day that you're like, oh, shucks, what the heck? so it's a time for you to continue to learn. We're in a professional, lifelong learning, and it
True.
doesn't stop after dental school. If
This is
anything
true.
else, it should accelerate immediate after dental school. And a residency is the best way to do that. You've got mentorship, you've got leadership from attendings that are going to help and guide you.
True.
But it's also an opportunity for you to really now become a little bit more, or in some cases, a lot more competent, clinically competent, and have enough, or have more, or increase confidence in what you're doing. A lot of it because it's repetition. You'll probably see most first-year residents see more patients the first 6 months of residency than they do the entire year of both years of dental school.
True. Absolutely.
With seeing 2 patients a day, and that's
exactly.
If they show up.
This is true. That's true.
So I think you're spot on with regards to why why doing a residency is important, and I think you're right. I think you'll start to see some more states instituting that as a licensure requirement, or at least an option to obtain licensure in the state, because with that experience it becomes a little bit less of a patient safety or a public safety issue, because you do have that confidence as a practitioner, probably more so than you would maybe not doing a residency. And there's a time, there's a launching period for most people as far as that level of comfort and the level of confidence.
This is true.
And
you need that confidence when you go out, and I teach my residents every year about risk management, and, I let them know that, every year that, dental students are graduating from dental school, and medical students graduating from medical school, there is a lawyer that is also graduating from law school. Okay.
Right. Right down the street from the dental school. Right.
Exactly. And you need to know what to do. A lot of times for young dentists, the first thing that they think about after being in dental school for 4 years is going out and making money. But, if you're not confident in your abilities to perform or practice dentistry, and to know what you can do and what you can do well, and what you cannot do well, which is key.
Mm-hmm.
Before I became program director,
mm-hmm.
And I was just an attending, there was a young lady who was doing a root canal on tooth number 8 or 9. I know it was central incisor. And she was asking one of her colleagues for help. Now, this was the last day of the residency. On the last day of the residency, now I was, part-time attending. So I was just fulfilling an obligation that particular day. And when I saw that she did not know what to do, I told the resident, I said, no, don't help her. Let her do this, because, as soon as she gets her license, she's going to be trying to practice endo on other patients. The patient still got endo treatment afterwards. She was not able to fulfill, believe it or not, she was not able to fulfill the obturation that day. And I told her, I said, when you go out into private practice and you apply for a job, you may as well just tell them up front that you don't know how to do endo.
Right.
Just tell them up front that I don't do endo.
Right.
Okay. So you can do dentures, you can do you can do a filling, whatever, but endo, you can't do. Now, mind you, I save that story for my residents every year. So they can't come into my program thinking that they can scathe by not doing endo. No, they have to show me, they have to prove to me that they can do this. Okay.
Right.
And, this type of thing is important, because if I didn't even have that conversation with her, she would try to do endo on someone and it would come out looking wrong, and she would probably get sued. And, going through the whole legal ramifications, that plays on your psyche when you're trying to provide care for other patients.
Yeah.
So risk management is important. And, the young docs, they need to be able to know that. So, I've had a host of experiences over the course of 15 years, but, it's really important,
Yeah, it is. It's key. And key to that is you doing, or individuals doing, their own assessment, their self-assessment. And it's okay if you're not professional, you don't feel comfortable in one area. You rather know that so that you can address it than try to, gloss over it and pretend that you know how to do the endo.
Yeah.
And, if the patients may not necessarily know, but your colleagues that are restoring it or will see it another, a couple years later and wonder, oh, this is why this endo failed or it had a failure to heal. So doing that self-assessment is key. And I think you have more time and greater understanding of that importance when you do a residency.
This is true.
When you do a residency. So,
this
has been so helpful for you guys that are listening. I know you guys have gotten some value from this. Please write down here in the comments what you like most about this video. Please share it and send it to me right here at newdentistcoach@gmail.com. newdentistcoach@gmail.com. Dr. Boyce, what's the best way for people to get in contact with you, or if they're interested in applying to your program, what's the best way to get in contact with you?
Yeah, so my email address is rboyce@tbh.org. They can send me an email. Telephone number is 718-250-8963. And my extension is 8105 if they want to, call and talk to me. It's tough when you're actually tough finding time, if you will. But I will eventually get back to phone call or email. But I encourage the young people really offhand just to apply, because, one thing about learning about a program, if you will, there are programs that post things on the internet and so forth like that, and that's fine. But actually sitting down and talking, like kind of how we're doing right now, they gain, another level of trust. Also at the same time, at the interview, I'm not sure how you handle your interviews, but when they come to my interviews, I take them down to the clinic. I, introduce them to the residents, introduce them to the attendings that are there, so they can get a feel of how our day is. And, that is really the time that I open up the door during the interviews. But I think that's important. I think it's key. I think this platform that you have is just, just a wonderful blessing to the young people that are interested in dentistry. And God bless you for your efforts and, for even inviting me to speak to the young people. But, it's not an easy profession. It's definitely not for the weak. Tuition costs have, increased over the years. And with that, you have interests that are tacked onto that. And young people need to really know about the cost of going through 4 years of dental school before they commit to it. Once they can deal with that aspect, I think, hey, they're ready,
Yeah,
but there's still much more, and they do need coaching, and they do need,
Yeah, and you get that much more, I think, in residency. You get that mentorship, you get the coaching. Most residency programs, you'll get paid, so it'll be the first time that you get paid to learn instead of paying to learn.
True.
And I think people should really understand the the importance of taking advantage of that. In many cases in residencies, you'll have attendings that have over 100 years of experience combined, maybe even close to 200 years of experience, all of which are right at your disposal, right here.
Right.
So I think that's where there's so much value in doing a residency. The bills, the debt, it'll get paid, but I think you put yourself in a better position to be able to navigate the business of dentistry by doing a residency, and the learning that you have the opportunity to gain, and the self-enrichment and development that you have during that time versus that 1 year that you didn't. So
Amen.
I mean,
Amen.
I mean, I think that's all we can do is continue to share with everyone the importance of doing a residency and what to expect. And
people shouldn't really look at the monetary. Sometimes, people look at, what they can get in private practice upon coming out, and they compare it to what they get in the course of the year of a residency. And they, but you can't really look and judge based off the pay, because what they gain in that personal interaction with the attendings and with the patients, and the ability to be able to kind of pace yourself. I'll share one other story with you. I had a young man who called me from, he was in California, and he was a graduate of the University of Michigan. And we know University of Michigan has an excellent dental school and an excellent reputation. But the young man was calling me to ask me if I had any open positions in my residency program. And I told him, no, all my positions are filled. And I was asking, why didn't he do a residency? And he said, well, I thought that I could go out and do private practice on my own. And I realized that I should have done a GPR. Now, he realized this after he went into private practice. And then he asked me, what do I need to do? And I told him, you need to go back and apply through the pass application and the match.
Quickly.
Yeah.
Yeah.
Because it's a year process before, that even starts up. So, it's important. And even for the young people that are watching this now, if you're interested in a GPR or AGD, you need to be applying right now. Don't wait till October. Don't wait till November. Yeah. As soon as the pass application and match opens up, that's when you need to be applying to your residencies.
That's right. That's good advice.
We get people who apply real late, super late, like December. That doesn't look good. So that's a bit of my advice. I think we've shared quite a bit of information, between two program directors and knowledge, and hopefully the young people will understand the nature. And let me just say, that person who did not, who was getting the endo, an endo on an anterior tooth, like a number 8 and 9, that's like the easiest endo that can be done, the easiest.
Right.
And so we expect, as program directors, residents to be able to fulfill, that sort of mission. And when they can't, and we know it's the easiest procedure in that particular discipline, that's a problem. And, and they, young people need to know that. So, and if I didn't tell her, that means that no one would have. If I was not there to tell her, no one would have told her.
Right.
And, that information was shared with, the program director, was shared with other attendings. But that was about the best bit of advice that we could give her.
Yeah.
She did get some probation. She was placed on probation. But at the same time, we had to, we had to protect her.
Yeah, and nothing's wrong with probation / corrective action, because that's going to give, lead you to the pathway of success and greatness. Rather do that during the residency than to have no corrective action, at least initially, and then the corrective action being on the private practice side is a lawsuit.
This is true. This is true. And no one wants that. Trust
No,
us.
that's the wrong type of corrective action that you want.
Exactly.
So man, this has been great. And I think everyone listening knows the importance of the things that we have shared today. You guys also, again, feel free to share this information, this video, with other people. Also, check out this next video right here that's coming up. Check this one out. And hopefully this has been helpful. This will be helpful as well. Dr. Boyce, Program Director at Brooklyn Hospital, thanks so much, and we'll talk to you soon. Good luck with your incoming class. Take care.
God bless, man.